I have a lot of caregivers within the patient community, and the big question for them is, how do I have these conversations with my child's doctor? But more importantly, how do we as a family make the decision on whether to move forward or if this is the right approach? So can you kind of share a little bit about how you came to this decision with your son and the types of conversations you had to have as a family?
Okay. I will say this. You have to have great communication or initiate communication with the doctor first. Just so happens that my child actually sees the head hematologist, and he's seen him since he was an infant at the same establishment. But the conversation with my son definitely was one that was something that I wanted to prompt a little bit more. His doctor mentioned gene therapy to him and told him that, gene therapy is coming along and that's probably going to be one of your options, very soon. And he would say that during visits. And during that transition stage, I feel that's an important stage. And I have to mention transition because those are the times that I started to get very quiet and allow my son and his doctor take over the meetings and conversations. Also, I stopped attending once he got, I want to say it was about 18. I stopped attending all the visits. I now would let his older sister go with him to the visits. But here I was, I'm still the mom, right? So I will call. I will call and say, as soon as you get there, call, let me speak to the doctor. And that's what I would do. And just get my brief concerns in and then hang up. But I think having the conversation with the child is important. Not only the child, I want to say that even adult patient, because as a caregiver, you never stop giving that support. So having the conversation and being that listening ear also to talking about the option of curative therapy and what are their thoughts. I think that is important conversation because we already understand the impact of sickle cell. There's organs being affected, right? There's life that's actually being expected. There's the planning for adulthood, basically for that interaction with even having a, partner later on in life. Some important conversations also there. We know that the planning stage also will come in place. So having the conversation, I have to say, is important for gathering resources. And where do you get those resources? Having that conversation with the doctor for the doctor to also be able to give you resources that you can look into. For myself, I told the doctor that I was going to educate him more on gene therapy and also for bone marrow transplant. And I said, my next step was we're going to get tested because I want him to know his options. So that was one of the first steps. And at the time, I don't think even my other children kind of understand. So I was explaining also to them, what does this mean? You're going to get tested. So I was I'm bringing them in and explaining to them. But I would say this, definitely speaking to the doctor and also tapping into community-based organizations in order to get supportive information on education over material, as well as knowing where the sources that are doing clinical trials, where the sources that are also doing the bone marrow transplants. The doctor that my son's doctor referred him out to Johns Hopkins, out in a total different area from where we are. So it's almost like a 2-hour drive. So not that we didn't have another treatment center that is closer, but he thought this would be the best option for my son. My son was now, he was now 20, going to be, when he made the decision, he was 19 at the time, between 19, almost 19 when he made the decision. When we first got the notice that my son actually had a match, and that was a referred treatment center. So not until he made that decision was when we had to come into grounds. But the treatment center was important to me. So researching that also and meeting the team. That team will make the factor. And I will say this, you have to be able to ask as many questions as you can. And I will tell you, I did that. I also let my son do that. I want to say my son asked to have, I mentioned before, my son asked to have private conversations with his doctor because I told him every time you think of a question, just write it down. You won't remember thereafter, sometimes leaving and these appointments. And then you have to think about what does it involve? So making decision also had to be, you have to think about one thing. He's young and he had to also think about reproduction, right? So how is this going to affect that? So we had to definitely also see a specialist also that will talk to him more about that, because the team will talk to him about it, but they're not going to go into depth. And that is one of the things that I, as a parent, also had to go into depth in talking to him about it. And it was an uncomfortable conversation for him. He was like, Mom, wow. So I have to say, not only making the decision, but grab onto your resources, your advocates in the community that are actually talking, making this so accessible to have sessions to talk about this. And I want to say that's through a lot of the community-based organizations. And it's so important to ask as many questions as possible and feel comfortable asking those questions. I want to say I came in, I had a book, brought a book to the appointment with me, and I wrote them all down. My brain was going, I think, 20 miles per hour, asking those right questions. I want to know, how many bone marrow transplants did they do? Have they done so far? How successful were they? How unsuccessful? How many unsuccessful cases did they have? You ask even the hard questions, because it's going to help you make your determination on, is this right for you? And I also have to say that gravitate to your team of support, because it is an emotional roller coaster, not only for helping your patient, your patient child or adult, family member, but you will go through your own emotional roller coaster that you may not be able to express to them. And I can say I didn't express to my child a lot of the emotions that I was going through, but I had a support team that I was able to express that with. So that all came with also the decision and the process.
Thank you for sharing that, because I think a lot of times not everyone takes advantage of the materials and the resources they have, and you seem like you took full advantage of those. Charles, I'm going to kind of segue to you. Now, you mentioned that prior to embarking on gene therapy, you weren't going to consider a transplant because you didn't have a match. But can you kind of walk us through what was the conversation about fertility preservation for you? And what is the conditioning regimen for gene therapy? That's a question I get all the time and I don't know the answer to. So if you can better kind of educate us on what the conditioning regimen is like, and was it going to, if you did go through chemotherapy, was it going to impact your fertility?
All right. So the fertility options was given to me. I had to go to a company to preserve, some fertilizer. So with that in place, I felt like it was okay for me to proceed. The conditioning for the trial, I had to go through about 2 years worth of workups. I believe I initially went through the hydroxyurea protocol, and then after I successfully went through that, we had stem cell collections. I went through 2 of them. We had multiple MRIs, X-rays, physical tests, just to sort of make sure that I guess I'm qualified, or I can. I'm looking for the words I'm trying to say here, but so I went through multiple tests and physical tests as a conditioning. The long term. What was the last question here? I'm sorry.
It was, did you go through chemotherapy or radiation prior to the gene therapy process?
Yes.
And
yeah.
you already answered the question of fertility, which is that you went through a sperm bank to make sure that your fertility was going to be okay post-clinical trial. Right.
So before I got my stem cells, I went through my chemotherapy. It was like 3 large bags of Busulfan that was administered to me through IV. That process, I can tell, was very hard. Immediately 3 days out the gate, I started to lose sort of my eyebrows, my hair. I went through hyperpigmentation. My skin turned very dark. And then it's going through sort of everything, digestive system was very raw. So everything I ate would bother me. I had to be put on a liquid diet and soft food diet. Now, that also sort of played effect, the hyperpigmentation. And when I was released from the hospital, I had to sort of overcome that. Yeah, I'm sorry. I'm sort of thinking about this is making me sort of getting kind of emotional because it was an emotional roller coaster. I'm having to go through the chemo and looking in the mirror and not even, knowing who I was, not even recognizing myself was very hard. So so pardon me. But I could say after the gene therapy, living life, I had 2 kids, naturally. So you can still have kids after the gene therapy. I have 2 kids naturally. So they're one's 2 years and one's 4 months.
Well, congratulations, because
you.
I think that's a recurring question I've gotten as well, is like, okay, have you tried to have children post-clinical trial? So hearing your success story is super inspiring. And I totally understand when you say it's emotional, because I think for a lot of us, we had tunnel vision when we were going into it of choosing optimism every day, even though the conditioning regimen is brutal on your body. I always say it's like being in a boxing ring without any protective gloves. So I share in that emotion as you were speaking earlier. And I think as different people spoke, I started to notice my emotions kind of bubbling up, because this really is a journey within itself. Christina, for you, now that you've participated in your clinical trial, I'm keen to hear your thoughts, because you are in healthcare as well. How has it been navigating that process? Because for many of us, we struggle with a sense of identity. Sickle cell is almost to a certain degree like it was a security blanket for most of our lives. And then now you're having to adjust to no longer having sickle cell disease. So how did you manage, as kind of working in healthcare, going back to the office, your colleagues are looking at you, but you might still be experiencing other issues from having sickle cell most of your life?
So after my transplant, I kind of ran into a couple of issues. One being, how do you identify your pain? So having sickle cell, of course, we had crisis. And after a transplant, it's not like you immediately stop having pain. There's a period of time where you still have some of that chronic pain that the bone marrow transplant doesn't reverse. For example, I had both my hips replaced, so I still had a lot of chronic hip pain, a lot of chronic lower back pain, and even some acute pain after my transplant in the first 6 to 9 months. So going to the ER was relatively rough for me, because I feel like emergency room doctors aren't really educated about life after transplant for sickle cell patients. For me, I struggled with, what do I even say? What do I even write on the ER paperwork? Do I write pain crisis? And I would go to the back and they'll say oh, are you drug seeking because you don't have sickle cell anymore? You had a transplant last week. You just got out of the hospital, you just got your transplant. And they don't understand that it doesn't work like that. You don't immediately, you're not immediately ridden of that pain. So that was tough. So I ended up having to see a palliative care doctor. And while I was in the hospital, I dealt with a lot of mucositis, and that was, I think people don't understand how painful that is. I had to get put on a PCA pump. So dealing with that post-transplant was kind of rough, because you go from being on all of this pain medication, my doctor paid me about 180 pills of oxycodone per month. And it's looking back, it's wow, I really did have to use that much pills. So you go through a period of, okay, now I'm cured, I don't want to be on this medicine anymore. I just want to go cold turkey, but it's you can't do that, because you go through withdrawal symptoms. So that's something I experienced. And I couldn't really go back to work. I took a year off after my transplant, just because I dealt with a lot of fatigue and some of that pain I talked about. I went through some acute graft versus host disease in my skin. So I had a full body rash, my skin just completely shed, and I just had some new skin kind of regenerate. What else? I dealt with survivor's guilt. So just seeing that, I had friends and like relatives that passed away from it, and now I'm cured and, living a life that, we all want to live. So I dealt with that. I feel like after transplant, your role kind of changed, like in family, for example, like personally and professionally. You go from just the expectation, I feel like it's kind of like they put a high expectation on you as far as like, maybe while having sickle cell, you were kind of like not really like financially stable because, you were either in the hospital, sick, or missing work. So you go from that to, I feel like my family kind of expected me to kind of take on that role as like a provider now because they just thought, oh, well, you're cured now, you're good. And it's not like that at all. Like you go through kind of a period where I have to get back, like it's our new normal because normal to us wasn't, normal to people without sickle cell. So I definitely had a new normal that I had to get used to and kind of like sit down and talk to my family and my friends and say, hey, like I may not be immediately available to party with you or to, take over rent or whatever it may be, whatever like things they put on you to take care of. So that was kind of rough for me. So I feel like seeing palliative care was helpful because they put me on a regimen where, okay, you were on 15 milligrams of oxy, now we're gonna do 10, now we're gonna do 5, now we're gonna give you 30, 15, or now back then it was scheduled and now it's as needed. So still going through that process, and now I'm like completely off of narcotics. And kind of take like Motrin and stuff for thank you. Take Motrin or Tylenol for pain. I mean every now and then, of course, like I still have to take some more stronger narcotics just because the pain sometimes that chronic pain sometimes is kind of unbearable. But for the most part, my pain is gone. What was the other part of the question you asked? Sorry.
No, I think you actually covered everything as far as what are some of the things you dealt with post-curative therapy. But I guess I wanted to know about you, like, since you work in healthcare as a nurse and you work in a BMT unit, did your colleagues kind of look at you differently, or did you feel like there was now an additional expectation professionally because technically you no longer have sickle cell, so
Yeah.
you should be able to commit to a, you know what I mean, like
Oh
longer
yeah, for
hours?
sure. Like oh yeah, for sure. Like I was scheduled like 16 days straight. And it's like, I'm still like, I still come home and like feel pain, like just from working long hours, and my shifts are 12 hours per shift. So I feel like because it's a bone marrow transplant unit and I went through a BMT, they kind of understand a little better. But as far as like management, I feel like the expectation was definitely put on me to like show up. And I had a per diem job recently. It was a BMT like outpatient infusion where they got their BMTs outpatient. And I was sick for like a week, just like dealing with some hip pain, and I got fired. So it's like whereas back then I would have missed like 2 weeks, 3 weeks at a time when I wasn't fired. Like I didn't get any like I didn't have any effects from it. So it was like I feel like the expectation definitely changes professionally and personally. They expect you to show up. And it's like, of course you try to show up, but some days you just can't. Like I tell my patients all the time, it's okay to have those days where you're not strong, where you feel like you just need to have that off day and just lay in a bed all day, where you feel like you can't get up and walk that day. It's okay because everyone looks at you and expects you to be strong, and you're so used to being strong because we dealt with sickle cell, we dealt with pain every day. But it's like, just because you're used to dealing with pain doesn't mean you have to suffer through it. So I felt like they didn't really understand that it kind of took time to get to a point where you're no longer dealing with fatigue or pain and stuff like that.
Thank you.
Wunmi, you're muted.
You're muted.
I apologize. I was saying thank you for sharing.
Oh,
But Simone, what I was gonna ask is there anything that you didn't anticipate after the curative therapy that has shown up for you now that you are 6 years out?
For me personally, I also didn't, I also work in healthcare, so I wasn't anticipating that unexpected, shift in perspective where you are looked at as just a completely new person who can essentially take on all these things. And working, at the time I was working at Johns Hopkins Hospital in the blood bank, which can get pretty intense depending on the surgeries for the day, if there are massive transfusion protocols. Sometimes because of staffing being short, overnight shift will call out, and now it's like, oh well, you're not sick anymore, so you can go ahead and work this 16-hour shift. So I definitely relate to you, Christina, where it's like, hold up, I didn't say all of that now. But on top of that, I mentally just was not prepared. I know someone in the chat was asking about survivor's guilt, and the survivor's guilt was intense because as you all know, it's like I went through this and I survived, and then I look at the people around me in my community who didn't, and then that also it compounds with the identity crisis of, okay, how do I identify? Do I still call myself a warrior? How do I show up? And for me personally, because I never was in advocacy pre-transplant, simply because of my capacity mentally and physically, I had a lot of shame with my sickle cell disease. It was kind of like a dirty little secret for me. I felt it made me feel like a burden to my family. For me, I looked at it as a form of baggage. So I didn't like to talk about it at all. And after going through the transplant, realizing that mentally it was really tough because I'm alone. Like I didn't talk to anyone. I didn't know anyone with sickle cell disease, let alone anyone who had a bone marrow transplant. So I'm just trying to go through the motions of understanding what I just went through. Who am I now? How do I move forward? Why is this my life right now? Like, I'm grateful, but I couldn't find the joy at all. And it made me realize that I had a lot of unaddressed depression, and mental health was never a priority for me because my physical health always was the priority. And it just at one point of time like felt trivial. But I never was exposed to resources that would encourage me to check in with my mental health. So I think for me, post-transplant, the mental health journey was one that I absolutely did not expect. The isolation, the depression, even the PTSD from just being in the hospital and going through the transplant itself are things that need to be discussed, and more resources should definitely be encouraged.
Thank you. Chris, before I ask the question, I know personally for me, where I'm still struggling is follow-up care, because doctors don't know what to do with me. I technically don't have sickle cell. So I see my hematologist, but only a few times a year. For you personally, in your post-transplant recovery, how do you feel your follow-up care measures to when you had sickle cell disease? Because I feel a lot of times in this curative therapy conversations, we focus so much on the treatment itself that we don't necessarily discuss what happens after. What is that lived experience like? So for you, can you kind of talk us through what your post-transplant follow-up care has been like? And do you still have any triggers today that sometimes make you feel like you might be going into like a pain crisis?
Well, my follow-up care is not as robust as it needed to be. I relocated from Nevada to Tennessee, so I'm in the process of trying to reestablish what I know I need after the transplant, which is my hematologist, which is endocrinologist, which is heart doctor, which is these other doctors that you need to have, because outside of the curative therapy, these things that are going on are still going to go on. The sickle cell may not make those things get worse faster, but you still have to deal with them, or they're going to get worse. So that has been the biggest thing. And like I said, it's not as robust as I would like. When I was in Nevada, I had better follow-up care than I have right now. I'm working on fixing that. I still follow up with my transplant team, so I do go back once a year, once every other year to check on where I'm at and how things are going, if things are progressing or not, and they give me an earful if I haven't followed up on everything. And I got an earful last time because So I haven't followed up on everything. And at this point, I don't have any triggers, so to speak of. I'm say 12 years out from my transplant. So I've been off the narcotics for some time, and I tend to stay away from anything in your mouth. I tend to use creams a lot for any pain that I have. If I can use a cream and not use anything that I have put in my mouth, then I do that because that's what works best for me. And I have bumps and bruises, aches and pains like everybody else, but my care, and like you said, it's hard. It's hard to actually get them to figure out where you need to most focus your care. Because like I said, you don't have sickle cell anymore. Now you have the traits. But looking at it from perspective of these people didn't really know about sickle cell anyway, so it makes it a lot harder because now you have to educate them on sickle cell. You have to educate them on what you've been through. You have to educate them on all the aspects of things that you have to take care of so that you can be here. I mean, and that's the hardest part is now you have to go back and re-educate. Now, the good thing is if you have a hematologist who you've been seeing for some time, then they're aware of what you've been through. They're aware of your transplant. They're aware of that aspect. So it should make it easier. However, if you're in a position like I'm in and you're moving from place to place, that may not be the case. Like I still don't have an appointment with a hematologist yet. And I just got the appointment with my endocrinologist for March 2024. So, so things are what they are. I mean, you just have to stay on top of it. I think what happens is we get the curative therapy go through, and then we think, hey, we're clear. I feel like a new person. I'm a new me. I don't have to be in pain every day. I'm feeling great. Great. Yes. Totally different night and day. But you still have to deal with all the other things that are there because the sickle cell generate that stuff beforehand. So yeah, you got rid of the elephant in the room, but still got that mouse in the corner.
No, I totally get that. I think self-agency is important from start to finish. I think as hard as we self-advocated when we had sickle cell, it continues on post-curative therapy because you are in charge of your own health. And until you're able to express to your providers how important it is for you to get that follow-up care, no one is going to fight as hard for you. I kind of want to let's go back just a little bit because I think as we discuss this journey, there are several nuances to navigating a curative therapy that people aren't necessarily privy to because they're so focused on eye on the prize. I just want to get better. I just want to no longer have vaso-occlusive crises. But can you share with us a little bit, Charles, what are some of the symptoms that you didn't anticipate but are there now? I know for me, it's memory loss. Chemo brain has continued 4 years post-transplant. I will go into the kitchen and be like, why am I here? And sometimes I wonder if it's age related or if it's related to going through the clinical trial process. And then when I connect with other patients, they're like, oh my God, me too. So, and then for a while, it was also insomnia when I was on the kind of medications that we take, immunosuppressants. I noticed I was having a lot of insomnia as well. So for you, what were some symptoms that you didn't necessarily anticipate, but you had to kind of deal with in going through this journey?
So after my chemotherapy, I started to intake or process a lot of things quicker than I would if I had sickle cell. So I can say anxiety, sort of PTSD, the intake that I'm having around me, like I can focus more on this, on that, on this. Well, it became too much at one point in time, and sometimes it can produce a lot of anxiety in me. Like, wait a second, I'm taking on too much. What's going on? Heart starts to increase. Those sort of things. Before I went through my chemotherapy, I sat down with a friend to sort of try to figure out the who am I or identity aspects after the crisis. And that's something that I really didn't realize that it was going to play a large effect sort of in my life post chemo. I still kind of feel alone. It's like my biggest journey in life was to be free. Sickle cell. Now that I'm free, what's next? That sort of mental health and identity. What am I going to do now? where can I go? My race is over. That's sort of, you know, how I feel like things. And so, you know, dealing with sort of the next steps is one thing that I did not, you know, expect in life, or expect after the gene therapy. I also have a lot, like you said, memory loss. I can walk into a room and why am I here? And I have to take 3-4 steps back and, you know, retrace my steps walking into the room. Okay, I'm here to get a pin. So those sort of complications.
No, that's very, very real. We don't understand the mind-body connection because when you're with sickle cell, the burden of the disease is so much that it manifests with your physical health. And we don't take time to process our mental. And I think one of the hardest obstacles for me to get over was that mental health aspect of things, because I know a lot of patients that we all feel like we're in a silos. We're now having to navigate life without this disease. We can't lean on our warrior friends. At least for me, I feel sometimes I can't lean on my warrior friends because they're still dealing with the day-to-day of living with sickle cell disease. But then I can't lean on my family because the assumption is she's cured now, so she's fine. She has no issues. And so you're just in a space where you're like, who am I? What comes next? And am I going to be able to get through this? Because this is a sense of self that I've never been introduced to in the past. And so I understand that. And then for you as well, to also add a layer of being an African-American male, where there's a lot of stigma that you're having to unpack as well. I can only imagine that, like, and even navigating parenthood, there's additional things that you're probably dealing with that is a bit harder to kind of navigate than it would have been in the past, but in a different way, if that makes sense.
Yeah, makes sense.
Carla, for you as a caregiver, I think a lot of the time we focus on the patient perspective, but as a caregiver, what have you as a mom, what are some of the quality of life improvements that you can see with your son when he had sickle cell and now that he no longer has it? And do you still struggle with caregiver burnout?
I would definitely say things that I notice is I feel like I was on demand before, whereas when a crisis happened, it was like immediate, like, because when he would have a crisis, it would wake him up at 8 and he would try to bear it. And it's always in the middle of between the wee hours of the morning, 3, 4, and I felt like I was always on call, like an immediate on-call person. And the change is that I don't worry about that. So that's like one layer of stress that I experienced. And I remember the last time he had a crisis, we actually took a trip and he came, like, no, actually on the trip, the last few days of the trip, he got a crisis, and I realized he wasn't socializing with everyone else, and I realized something's not right, but he didn't want to say that. So that also that communication, he waited. So I don't have to worry about that hesitation anymore. I had that conversation with him and said, anything that happened at this point, you know, you take in this leap to do this, anything that's immediate, we got to immediate address it. So I think the change now is effective communication. Now that when you're experiencing things, share it with me, but don't hesitate to call your doctor. Now, a change of conversation, you call the doctor, right? And have that conversation. And so I think caregiver burden has more lifted off of me. I don't go to every appointment with him. I don't do that. The team actually, they'll follow up with me as necessary, and he'll come and tell me. So he does have frequent appointments still. Well, now they're, monthly, but I don't worry about the immediate actions of what the impact of the crisis anymore. I do not worry about that, because I want to tell you, every time he went into the hospital, because I experienced a bad experience when he was 8 years old, every time he went in, it was always a celebration for him to come out. So every time that he went in, even as a young adult, it was a concern for me. And every time he came out, it was a celebration for me. And that's because living with sickle cell, sometimes there's unexpectancies because of the harsh reality of damage that it's doing. Now, mind you, this is not a child that was very sick younger, but when it got aggressive in adolescence, it took over our lives. And sometimes I talk to other patients and they will say, well, my child never had a crisis, or my child never had a stroke. I will tell you that the very time that my child had his first, I want to say, immediate crisis, it almost took him out of here because other things were going on. He had an infection, he had an aplastic crisis. So when we look at the disease, sometimes it's unpredictable. We just don't know. And so I will definitely say the burden has been lifted off, per se, on worrying about sickle cell. Now it's more about communication with him to better care for himself, because remember, this is adolescent, still going through transition. Mom was doing a lot. I'm still taking off the rope of doing a lot. I'm slowly taking it off because I need him to know this is the time that you do more for yourself, but I'm here to support you. So I'll definitely say that it's a different even for me, and it frees up time for me also. I'm now looking at what else do I want to achieve and how am I going to do it? And I'm going to do it and setting new goals and putting that expectation on him. Set your goals, do what you want to do, because you was non-stoppable before and you're still non-stoppable now. Continue that.
Love that message. I think it's so important to remember that, like, even as patients, as we navigate a new identity, our caregivers are navigating a new identity as well. I think the grace that we extend to each other goes both ways, because I know from my mom, she was so used to always having to be there in moments of crises that now that I no longer need her, she's having to redefine and reestablish who she is as a parent, who she is as a caregiver, now that her child is no longer like sick. And so I'm happy that for you, you're able to kind of plan your life as well, because you now no longer have to worry about your child who was dealing with a chronic illness for all of his life.